Okay, hi everyone, welcome. We'll get started in just about a minute. Thank you for joining us today. Okay, it's right on the hour and we have 3 speakers today, so I want to get us started on time. Thank you for joining us. I'm Bethany McGowan, Chair of the IFLA Health and Biosciences Library section, and it's my pleasure to welcome Ruth Carlyle, Clare Edwards, and Dom Gilroy, who will be speaking on us about informed and evidence-based decision-making. Just a couple of housekeeping notes before we get started. This session is being recorded, so you will be able to go back and watch the recording. It will be posted on the IFLA HBS webpage. The other note is to please use the Q&A function for your questions and not the chat box. So if you hover at the bottom of your screen, you will see the Q&A function. And if you have questions, please pop them in that function, and our speakers will address them at the end of their session. So without further ado, I would like to welcome Ruth Carlyle, and please go ahead and kick us off.
Thank you for the kind welcome, Bethany, and thank you to the International Federation of Library Associations for the opportunity to present this webinar in response to the World Evidence Healthcare Day. We are actually presenting what is Health Education England's approach to ensuring that the NHS knowledge and library services embedded within our own National Health Service are well placed in terms of providing research and evidence from research in healthcare decision making. Our webinar is actually in 4 parts. So I'm actually going to be introducing the role of NHS knowledge and library services in promoting evidence-based practice in the NHS. My colleague Clare Edwards will then be demonstrating the value of librarians in providing the gift of time to staff. I'll then be resuming in terms of looking at health literacy and how it is that actually we can look at the skills for members of the public in terms of evidence for shared decision making, including a technique that you can have as a take home at the end of the session itself. And then my colleague Dom Gilroy will actually be looking at how it is that we develop the workforce, so developing the skills of the knowledge and library workforce and identifying the impacts that they make on health and care. So by way of a little bit of introduction in terms of what it is that we do. So in the UK, the National Health Service, or NHS, is funded through taxes and is largely free at the point of access to care. But the NHS is not a single organisation. It consists of hundreds of hospitals and other health organisations that operate largely independently. We're therefore dependent on policies and economic drivers to ensure the use of evidence in the NHS and the role of NHS knowledge and library services in providing that evidence. A key lever that's come into place just this year, 2022, is our new Health and Care Act, which imposes a duty on the National Health Service organisations to be evidence-based. It requires them, quote, to promote and facilitate use of evidence obtained from research. This is actually a very important hook for us, and it builds on previous legislation which has had similar aims since 2012. That evidence is then used to support what are described as the quadruple aims, the 4 main aims in terms of the NHS for its care. So building on patient experience, evidence about population for population health, reducing costs to make sure that this tax-funded system is as efficient as possible, and to provide support in terms of care team well-being, because without high-quality staff feeling supported themselves, we're not actually going to be able to provide the services to members of the public. So knowing the importance of evidence in the NHS has provided us with a hook to promote the value of knowledge and library services, which is in effect where our team comes in. So we are part of Health Education England. Health Education England is an organisation within the NHS in England that provides the strategic lead for training and education of NHS staff and learners. As part of that, it provides the strategic lead for NHS knowledge and library services within those NHS organisations. So we do not manage the staff in the NHS knowledge and library services, but we provide them with tools and resources, and we are also mandated in terms of providing quality assurance to ensure that there's high quality services available for decision making within the NHS. As part of our work, we have a joint campaign with the Health Libraries Group. So the Health Libraries Group is a cross-sector membership group that is a special interest group within our library association in the UK, which is the Chartered Institute of Library and Information Professionals. So working in collaboration with this membership body, we have a campaign to promote the use of evidence, which we refer to as a million decisions, in which we aim to emphasize the importance of day-to-day decision making, because we know that over 1 million decisions are made in England in the NHS every day. In fact, we think it's roughly 1 million every 17 hours, but we want to make sure that each of those decisions is fully evidence-based. And we call on government, healthcare providers to employ and make use of the skills of knowledge and library specialists in terms of ensuring that they are making the most effective use of evidence. And Clare will be speaking a bit later on in terms of the value that those knowledge and library specialists provide. So as part of setting our context as Health Education England, our strategic direction is embodied in Knowledge for Healthcare. That's our strategic documentation. And our strategy for the next 5 years sets a compelling ambition for knowledge management across the system to drive transformation and success. It's rooted in the value of knowledge and library services that have in education, but also direct in terms of action for change, to support transformation, to support innovation within good practice in the NHS itself. We believe that actually to maximise knowledge and library evidence, knowledge and library services are needed at all levels in the NHS. So this is not just your local hospitals, this is also our regional and strategic bodies to make sure that they are also making use of high quality evidence. And our national team provides professional advice and expertise to healthcare organisations and to the specialist workforce in terms of embedding these services. So our strategy itself has 6 main strands to it. So we mobilise evidence and knowledge. So how do you get evidence so it isn't just in a book, but is actually acted upon? Or how do you get the soft knowledge, the soft intelligence in people's heads and turn it into a knowledge asset that can actually be shared and used? We have quality improvement and impact. As I mentioned, we have a mandated role in terms of the quality assurance of our NHS knowledge and library services, of which is 177 services across England at the moment. We also provide support on health literacy and patient information, so ensuring that the patient information is evidence-based, and health literacy is the skills that we'll be coming on to later on. Resource discovery, so how do you procure cost effectively, provide systems for ease of access, and we'll come back to that in a moment. Workforce planning and development in terms of our own knowledge and library service workforce, but also professional leadership, advice and expertise. And as for each of those elements, we collaborate with local NHS organisations to make sure that local NHS knowledge and library services have the right resources, team, and provide the right services. But also nationally, we invest in high quality digital infrastructure for the NHS, and we lead the ongoing development of the NHS knowledge and library services. So thinking in terms of the resource discovery, the aspects in terms of digital access, we deliver the digital infrastructure and provide the central collection of digital knowledge resources. And taken together, 720,000 healthcare staff use these resources each year. These resources consist of those that we procure nationally on behalf of the NHS, but also where we collaborate with local services, that we have group deals for resource infrastructure. And we have a new knowledge and libraries hub, which provides a single infrastructure access to be able to access both the national resources, but also the local library services. And as one example in terms of this support through, we've actually been investing in clinical decision making. So we have a particular product that we purchase, which is British Medical Journal best practice. And this tool is structured in a slightly different way from how you would look at evidence normally. So it's structured according to the medical condition, the national guidelines, and then actually the evidence that's underpinning it. So that's then information structured in a way that you can use in a conversation. A clinician can use, actually, if they're thinking about the needs of a specific patient. And actually this usage of personalised care supports all the way in which we have evidence at the bedside as well as out in the community. So we have an infrastructure we provide, and we provide strategic direction, but actually those only underpin what it is that we do in terms of demonstrating the value. And my colleague Clare Edwards is going to talk a little bit more about actually how it is that we demonstrate the value of NHS knowledge and library services.
Thank you, Ruth, and good afternoon, everyone. So the experience of the pandemic has really thrown into sharp relief the importance of our NHS knowledge and library services supporting evidence-based decision-making. And you'll see from the slide on the screen a quote from Professor Chris Whitty, who was the Chief Medical Officer in England during the pandemic, where he's really emphasising that important role played by knowledge specialists across different sectors during the pandemic. So if I can go on to the next slide, Ruth. Thank you. So just moving on and understanding that impact and that value of our knowledge specialists. In this section, the next few slides, I really want to talk about the value of our knowledge and library services for healthcare staff and organisations. What I'm going to go through is a report, and it's set in the context of the NHS in England. However, the findings are applicable to other contexts. So an independent health economic study reports that knowledge specialists give healthcare staff the gift of time. And in the NHS in England, the report demonstrated that our knowledge and library services are delivering a net economic benefit of 77 million per annum. That's accelerating access to high quality evidence and taking the heavy lifting out of getting evidence into practice. And within England, this allows the NHS to meet its duty to use evidence from research, which is currently in the Health and Social Care Act in England, and for NHS staff to use time effectively. And these findings are actually without calculating that impact of implementing the evidence itself. So I'm now going to spend a little time talking about the study and the findings of the report. So our report is called The Value Proposition, The Gift of Time, and it was published back in November 2020. And if you want to go and have a look at the report, the URL is on the screen, and it's on our Health Education England website. And we worked with Jack Mallender, an independent health economics from a company called Economics by Design, to undertake a review of the value proposition for NHS funded knowledge and library services. And the report itself draws on robust published research and also selected case studies from the NHS in England to describe and model the potential economic value of a well-run NHS knowledge and library service to its users and its funders. And there are 10 key messages contained in this report. So in the next few slides, I'll provide an overview of these. So Ruth's already provided a little bit about the NHS, but in the context of the report, actually, our knowledge and library services operate across a diverse and complex customer base. To provide an overview, the NHS knowledge and library service in England operate across the whole of the NHS in England. They cover rural and urban areas and sparsely and densely populated geographies. They're supporting healthcare professional staff working with citizens and patients of many different socioeconomic and ethnic backgrounds. They support healthcare professionals working in care delivery, education and training, research and management. And evidence and knowledge are sought across all settings of care. That's including specialist and general hospital services, services provided in the community, services provided in primary care and GP practices. And the NHS library knowledge services support decisions made at board level in the organisation, right through to shared decision made every day by patients and healthcare professionals at the bedsides and in clinics. All therapeutic areas are covered, including evidence to support citizens to self-care and stay well and healthy. That's to help with decisions related to choice and delivery of specific NHS treatments, and evidence relating to the effective management of care for people living with long-term conditions. And in addition to informing clinical decision, evidence is required to inform many other areas of healthcare practice, including management decisions, research pathways, and guidance development, education, learning, and legal considerations. Yet time available for our healthcare professionals to devote to searching for the evidence is limited, and they can often lack confidence and the skills to perform those high quality, effective searches. So the services provided by our health librarians and knowledge specialists take that heavy lifting out of getting this evidence into practice and give the gift of time to these healthcare professionals. So decisions by healthcare staff and NHS organisations informed by evidence improve outcomes. They improve the quality of care, patient experience, resource use, and operational efficiencies. And the report found that this is best achieved when healthcare professionals are supported by high-performing knowledge and library services. The organisation is then able to demonstrate that they use evidence to inform practice and demonstrate better patient care and safety. Go on to the next slide, please. Thank you. And for the individual user who makes use of our knowledge and library services for clinical or operational benefit, or who might otherwise have to undertake the research themselves, the knowledge and library service enable that cost-effective, that accelerated access, that higher quality evidence, which is timely, relevant, comprehensive, and importantly, quality assured. So taking all this into account, the report provides a simple core value proposition, which is the service provides healthcare professional staff with time-saving, accelerated access to better quality evidence. This enables the NHS in England to meet that statutory obligation to utilise evidence from research. It enables healthcare professionals to use their time more effectively to drive improvements against the quadruple aim, which Ruth mentioned earlier in the slides. So I want to talk a little bit about the research that went into the study. And this wasn't primary research, but it used a range of evidence. So firstly, a rapid review of 3 high-performing knowledge and library services was undertaken. The services were selected on the basis that they were rated highly through our quality assurance processes, but also the organisations that hosted them also had outstanding quality ratings. And these case studies demonstrated 2 key enablers for benefits realisations. Firstly, that the Knowledge and Library Service has a clear strategic leadership role in knowledge management and mobilisation within the organisation, and that the knowledge specialists are integrated and embedded within service delivery and quality improvement within the organisation. Go on to the next slide, please. And then, as well as the case studies, we also looked at a growing and consistent body of robust international evidence to support the value proposition. And I just want to highlight 2 of these studies. So a comprehensive review of the literature was undertaken by IFLA and found that academic libraries and special libraries generated significant return on investment. So for health libraries, based on savings of time for users and expenses for organisations. For every dollar spent, $2.4 were generated. There were also further studies in the literature that found that professionally led library services have an impact on health outcomes for patients and may lead to time savings for healthcare professionals. But there was also published research from the NHS that suggested similar benefits. So an economic model that was identified through a rigorous study carried out in the Wirral University Teaching NHS Trust in their critical care unit showed that on clinical time savings alone, the clinical librarian service provided a return on investment of 50%. So that was a benefit cost ratio of 1.5 for every pound spent. And including the wider benefits for staff and patient within the context of critical care, the overall return on investment increased to 200%. So that's a benefit cost ratio of 3 for every pound spent. There are many other studies that were also considered when carrying out the report, and these references can all be found in the report if you want to go and have a look at that after our webinar. So on the assumption that the findings from this international literature review are also applicable to the NHS, that a cost-benefit ratio of 2.4 for every pound spent is currently being achieved, our knowledge and library services in the NHS are actually delivering a gross economic value of 132 million per annum. And this translates into a net additional economic value of 77 million. And that's based on investment of 54 million. And this, again, only includes the benefits arising from the time savings from users and expenses for the organisation. It does not include the net benefits of improved patient outcomes. A recent Health Education England review of the ratio of qualified librarians and knowledge specialists to NHS staff also suggested that there was large variation across the country. And we carried out a review to recommend a move to a target of 1 qualified librarian to every 1,250 staff. So considering the costs of this increase and the potential return on investment, it's actually estimated that the net benefit of our knowledge and library services across the NHS in England could increase from 77 million to actually 106 million per annum. So just before I go on to the next slide, messages in the report have been very powerful in raising the profile of knowledge and library services and demonstrating the value and impact NHS organisation and senior stakeholders and funders. So we've developed an animation to support the messages of the report, which Ruth is now going to play for you.
In the NHS, we want decisions to be guided by evidence. It's enshrined in the principles and values of the NHS Constitution. Luckily, there's no shortage of valuable evidence. In fact, there's more of it every day. Lots more. Studies and research papers, articles and statistics, a veritable forest of evidence. Right now, busy clinicians and busy managers are spending precious time sifting through this evidence. But research shows that knowledge and library specialists are best placed to do this work. When knowledge specialists integrate with local clinicians and managers, they take the heavy lifting out of finding the best evidence to support decision-making. Now, those NHS teams are freed up to put evidence to work, improving patient care, patient safety, and patient satisfaction, transforming the quality, effectiveness, and efficiency of the care we provide. In fact, the research also shows that knowledge and library services can bring a cost-benefit ratio of £2.40 for every pound invested. Looking through the lens of the findings from this international research, it looks very much as if our knowledge and library services generate a net annual economic benefit of £77 million for the NHS, plus the many additional benefits of NHS teams using better evidence. And here is the opportunity. By improving the ratio of librarians to healthcare staff, we can increase this figure from 77 million to £106 million per annum. Trust the evidence. Invest in knowledge and library services and give frontline teams the gift of time. Time which can be spent caring for and treating patients.
So there is value and a cost benefit of healthcare staff working with the knowledge and library services team. I'm now going to pass back to Ruth to talk more about the value of knowledge and library staff in sharing skills to enable members of the public to use evidence in decision making.
Thank you, Claire. So Claire's been emphasising the importance of the role of NHS knowledge and library services in terms of providing support to clinical staff, professional staff, but also non-clinical, the managerial staff in terms of support decision-making in the NHS. But of course, if actually we're going to have informed decisions, shared decisions about healthcare, we need also to make sure that the public are in a position to be able to access and to use that information and to use it in ways that mean that they understand it and can use it effectively. So the term that we would use in terms of the ability of individuals to access, assess and use health information is health literacy. And we would tend to use the World Health Organization definition. So this is the personal characteristics and social resources needed for individuals and communities to access, understand, appraise and use information and services to make decisions about health. So the World Health Organization definition emphasizes that it's not just about individual skills. It's also about social resources. It's about how the infrastructure is set up, how it is that conversations are created in ways that actually people are enabled to make decisions. And the social resources that are included in terms of how it is that we have a more health literate society include libraries in all sectors, not just libraries within the healthcare sector. So if we think about having good health choices, health literacy skills, what are the implications if people don't have the ability to access, assess and use health information? Well, we have misunderstandings. We often have stories that are shared with us in relation to people who completely misunderstand how to use a device. So for example, individuals who are told in relation to using a condom for contraception are not realizing that it has to be worn by the male and trying to eat it. So that there's something about how it is that there's a safety issue if people don't understand what's actually being presented to them. Have poor decisions that don't actually relate to people's own lives or their own choices. And some of that might be that actually they could have had a delayed surgery, which could have meant that they could walk down the aisle with their daughter. But because they thought the only chance they would have will be at one particular point in time, they haven't made the decision that's right for them. It exacerbates inequalities. So people who are in areas in which there is less support from whether it's the NHS or elsewhere are often also the people who have less life expectancy more generally. We get inappropriate use of medication, so people who actually use more than they need to or less than they need to, with all the associated health impacts of that. Ineffective access to health services. And in a digital age, we'll come back to this, particularly its digital access, and therefore, ultimately, poor health outcomes, which as a health service, as part of the health service, but also as the society at large, is not what we want to see. So that's the scenario, and it's not a good scenario. But what's the scale of the challenge? Well, we're not talking about a minority issue. If you're looking at the issue in England, then actually If you take just words, information with just words, 43% of adults aged 16 to 65 struggle to understand, assess and use that health information. That's nearly half. And it's not that we think that people magically, once they get to 66, are able to understand, assess and use health information. It's just we don't have the data. If you add numbers in with the words, actually the figures are even worse. At this stage then, 61%, so over half of adults in England struggle to understand, assess and use health information. So let's think about that. Most health information includes words and numbers, the number of tablets, the number of times a day, the number of times you do a particular exercise. So if you're not able to understand numbers, then that really restricts your ability to be able to interact. And at points of stress, such as a diagnosis, for all of us, our health literacy goes down. We also have underlying issues. Certainly in England, our figures are 1 in 6 adults struggling with literacy, and 6 million adults, that's in a population of 58 million, who struggle to switch on a device. And if you can't switch on a digital device, that again creates barriers within a society in which there's an expectation that more and more services should be provided online. So that's our national picture in England, and I suspect it's very similar for many people across the world in terms of people listening into this webinar. But it isn't consistent. So one of the things that we did as Health Education England is that we worked in collaboration with the University of Southampton to develop local geodata at a borough level, which is our small unit of decision making in local authorities. And we found that actually, if you're looking at the variation at its very best, we have people struggling with words and numbers. In South Cambridgeshire, it's 46.11%, so just under half. And that's the very best. Whereas at its very worst, Newham, which is a borough in East London, our capital city, that's nearly 82% of people struggling. So significant variation and significant risk, because this can often underlie existing inequalities. So again, thinking about London as our capital city, if you think about the variation in our healthcare, it's very significant. And many of the issues that confront us here in England will be very recognisable elsewhere. We have coastal communities where there's very low health, rural communities where people may be excluded from ready access to healthcare, and we have significant urban mix. So this particular map is based on our map of our underground, our metro system, our underground tube stations, and it shows what people's life expectancy is according to the area around the particular underground station in London. And within London, so relatively small locality, in the course of going 6 stops on our metro, our tube, our London Underground service, your health expectancy in terms of the people around you, in terms of living in that area, can go up or down by 11 years. That's very significant variation. And across the total population, that means that actually we have a significant issue in terms of people and their health. So why should library staff make this a priority? Well, we would say that library staff in all sectors, perhaps particularly education, if you're thinking about younger people, public libraries, etc., play roles in terms of health literacy, because fundamentally, health literacy is a form of information literacy. It builds on fundamental literacy and numeracy. It then builds on your information literacy in terms of your ability to access, assess and use information. Builds on your digital navigation, particularly in an era where more and more information and health service consultations themselves are online. And then health literacy is the top of that. So all of those, in fact, how it is that we work across the system. And what we are doing as Health Education England is that we're actually collaborating with partners, particularly across public libraries, but also prison libraries, because in England we have legislation in place whereby prisoners, one of the few rights that they have is to be able to access a prison library. So we have a development with CILIP, which, as I mentioned, is our library association. Also Libraries Connected, which oversees our public libraries, and Arts Council England, which is one of the core funders for projects in public libraries. And together we're working to develop tools So these include things like e-learning, to cascade training, and also to develop local pilot sites, because there's nothing quite like testing in practice what actually works and how it is that you can make a difference. So I'm now going to share with you a little bit of a takeaway before I go on back to my colleague Dominic, in terms of a particular technique that you can actually use to improve health literacy, but also applies in terms of communication more generally. So one of the techniques that we encourage people to use is teach back. So rather than you listening to somebody and then them asking you to just say whether you understood or not, you actually, as the communicator, would ask somebody to paraphrase back what it is they've understood. And very often this might be in terms of asking a question to help people to reframe it, in terms of, for example, how would you tell your kids about that? Or how you would think about in terms of what your next steps for a decision might be, so that you can understand how much somebody else has taken away from what it was that you expressed earlier. And it's about the responsibility of the person who is sharing information is responsible for whether or not the other person understands. So it's the communicator's responsibility. And then it's about tell me what you've understood by asking a question that's neutral, that doesn't sound as though it's somehow your fault if you didn't understand what's just been shared with you, that you re-explain as needed, and that you continue back and forth to some degree until you're both happy with the understanding. And quite often you would use this with what's referred to as chunk and check, so very short pieces of information rather than necessarily a huge amount. But whether it's talking to teenagers or whether it's talking in terms of your healthcare, there is something which is very valuable about how it is that you communicate in a way that enables people to express what it is that they've understood back to you, and to improve that for the future. And if you're interested in terms of developing your own skills further, then we also have free e-learning available on health literacy. And I'm now going to then transfer on to my colleague Dom, who's going to talk about our own NHS knowledge and library work.
Hi, thanks, Ruth. And yeah, so we're going to say a few words about our NHS knowledge and library workforce, and this is in England we're talking about today. And the importance of our workforce, of course, is that these are the people that do all the work, and therefore these are the people that make the impact, by and large, when we talk about impact of knowledge and library services. So thinking about these people and the numbers and so on. So Health Education England runs an annual statistics survey for NHS knowledge and library services. And so we know that as of April 2022, we had 996 whole-time equivalent knowledge and library staff working in the NHS with NHS services in England. And obviously some of these staff work part-time. So thinking of actual head count, the number of actual people, bodies that we have in our services, that's closer to 1,180. These staff work across around 174 individual knowledge and library services, and you can see then that on average our library teams are relatively small. So as a mean average, we'd be looking at around 7 people per service, but some of our services are considerably smaller than that. Thinking about the breakdown between professional and paraprofessional administrative staff, around 2/3 of our workforce are working in professional roles, and we'd expect these staff to have professional qualifications, perhaps from our CILIP accredited courses, or holding a professional registration with CILIP at chartered or fellowship level. CILIP, of course, is our professional body in the UK. And that means that around 1/3 of our workforce, around 37%, work in paraprofessional or administrative roles, things like library assistants, library technicians, and so on. Thanks, Ruth. Now, Health Education England's knowledge and library team, the team that Ruth, Clare and I work for, part of our responsibilities cover the development, training and upskilling of this small but highly specialist workforce to ensure that we have the knowledge and skills that are required to support the NHS of today and tomorrow, and to undertake some of the work that we've described already today. And to do that, we deliver learning opportunities through our NHS Knowledge for Healthcare Learning Academy. We offer CILIP accredited short courses tailored to the needs of our workforce. Now, CILIP has developed and recently refreshed a professional knowledge and skills base, which serves as a kind of catalogue for the range of skills likely to be required by library, knowledge, information and data professionals, not just working in health, but across different sectors within the profession. And so all the learning that we offer through the Learning Academy is mapped across to the PKSB to help our colleagues, our delegates on the courses, on our training, to see the relevancy and to be clear about the content of the courses in relation to the PKSB. Since the pandemic, most of our training offers delivered through the Learning Academy are provided as synchronous virtual courses rather than face-to-face sessions. And the team is also developing e-learning opportunities in partnership with our e-learning for healthcare colleagues within HEE. Thanks, Ruth. So we've talked a lot about impact so far. What do we mean when we think about impact in relation to NHS knowledge and library services? So as our starting point for impact, we use this ISO definition shown on the slide. So impact being the difference or change in an individual or a group resulting from their contact with library services, and more often than not with a library and information, library and knowledge professional. And in the context of healthcare, this impact might be at individual level. So for example, by increasing an individual's knowledge or skills or expertise, or it could be at an organizational level. So for example, saving money for the organization, thinking back to some of the slides we saw from Clare about the gift of time report. Obviously, within health and care, the system itself is quite a complex one. And any one outcome is driven by many different factors. It could be lots and lots of different individuals working together. It could be teams. It could be other factors. And because of that, it's quite often impossible to argue that any one outcome is solely the result of one factor, one team or one decision. So thinking about an operation, the outcome of that operation will not just be down to the surgeon, but also the skills of the anaesthetist, the nurses, the people who prepared the patient for surgery, people who sterilised the equipment, cleaned the operating theatre, the list just goes on. And a similar case can be made for most outcomes within healthcare. However, that's not to say that we cannot claim that the services and resources of the healthcare knowledge and library service didn't have an important role in the impact and outcome that we're observing. Thanks, Claire. So thinking about impacts then, and thinking about our theme today of evidence-based practice, who decides, what's the evidence of what the impact knowledge and library services are having in any given situation? Well, could it be the knowledge and library specialists providing the service? Thinking objectively, well, probably not, because they're too close to the situation. They're the ones delivering the service, so perhaps they're too involved in it to be objective. Any observer may say, well, of course they're going to say that their work has an impact on the individual or the organisation. So instead, the approach that we take within the NHS knowledge services is to look at the health and care staff who receive the service from the library. They are the ones who are the recipients of the literature search or the training or whatever service has been offered. And so they're often in a good position to be more objective about the impact of the library's work and indeed whether or not there's been an impact. Another thing that we talk about when we're thinking about the impact of our knowledge and library services is the focus of that impact. So if we ask health and care professionals who use our services what the impact is on their work, that can sometimes be quite a vague and difficult question. So anyone, nurse, doctor, physiotherapist, manager, may use the library over the course of several months for a lot of different purposes. They might use the library space for study. They might request journal articles. They might attend information skills training sessions and so on. So thinking about impact, where do we start? So rather than this more general approach, Health Education England recommends what's known as a critical incident approach, focusing on a specific instance of the knowledge and library service assisting them, and then thinking about the impact of that particular instance. So this might be a specific literature search that they've requested, or a specific training session they've attended. It allows the individual to think more specifically about a particular situation, a particular service offered, and the impact on themselves as an individual, the impact on their team, and indeed on the wider organisation as well. Many services use a survey questionnaire and approach colleagues who've received services from the library. Send the questionnaire out after a designated period. This is usually a couple of months or so because the service has to have time to have an impact quite often. And then the information gathered from the questionnaires can be used to develop impact case studies. Case studies can be stories or vignettes detailing examples of the impact of the knowledge and library specialist on their particular use of the service. In some cases, our knowledge and library specialists work embedded within teams and are therefore so involved in projects that they may be able to move straight onto the case study or vignette and work with the healthcare professionals that they've worked with to create the details of the story. In all cases, though, we do ask that vignettes include a statement from the beneficiary of the service, i.e. not just the library staff, to endorse the work that's been undertaken. So we can look now at a few examples of these vignettes to see the kinds of impacts that our knowledge and library services have. So let's have a look at some of these examples. So impacts are usually, but not always, the result of evidence searches carried out by our NHS knowledge and library staff. And most of the vignettes we develop do detail the results of these searches. So in this example, we can see that we've made a saving, £26,000 a month, £312,000 a year as a result of reduced patient stays within the hospital. So a literature search has been undertaken, and the practice of our teams, the guidance has been changed as a result of that information, leading to cost savings. But also, as you can see there, it's not just cost savings, improvements in care, because patients aren't having to stay in hospital as long and they manage to get home to their familiar situations, familiar surroundings a lot more quickly. Sometimes finances aren't involved at all, so we can't always measure financial savings in our impacts. In this example, the podiatrist wanted evidence to support the launch of a new community practitioner role. So the impact here was about improving the patient's experience and their care. And obviously the evidence from the knowledge and library service is essential to support the business case, which would be needed to actually propose and then implement this new role within the trust. Thanks, Ruth. And as well as financial savings, knowledge and library staff can help with evidence associated with safety and risks as well. So in this example, healthcare staff were interested in using a different piece of healthcare equipment to deliver the services in a different way in order to reduce patient waiting times. But obviously it's essential in such cases that any risks are picked up and any possible dangers in using equipment in different ways are identified so that any risk to the patient can be avoided. In this case, evidence provided by knowledge and library staff was able to reassure healthcare staff and managers that practice could be changed safely, and again resulted in a more patient-friendly approach to the service, but also a slight cost saving of £20 per line. So thank you for listening to the presentation in general, all our different aspects of the services we offer. And obviously we have a little bit of time now, I think, for questions, if anyone would like to ask us any questions on anything we've presented this afternoon.
So thank you for that very interesting presentation. As for questions, you can either drop them into the Q&A function at the bottom of your screen, or if you raise your hand, I can unmute you and then you can actually ask your question on. So either raise your hand or drop your question into the Q&A box. And let me see, there are currently no questions, so let's just give people a minute to see if we come up with anything. Maybe I will get us started with the question. I think the conversation around impact I found particularly interesting because that's something that government agencies do, but we also see a lot in academia, people expecting sort of assessment and impact. You mentioned sort of short-term impact assessment, but are you doing any long-term assessment? And if so, can you describe what that looks like?
Yeah, thanks for that question. So so I guess in terms of sort of longer term follow-up, I guess it's more the bigger scale, the macro scale, the kind of work that we saw in the gift of time proposition, where we're trying to sort of gather lots of individual bits of data together to come up with the big picture, if you like. What we've not done so much of is tracking impacts, individual impacts over time. So for example, if a case study has been developed in a particular situation, say a couple of years ago, then following that up a few years later to see if the impact's the same or if it's grown and so on. We've done less of that actually. So a good point. Yeah, that might be something we need to look at.
Okay, great. So we did have something come in, but I think it might be more of a comment. Very interesting presentations. This is from Carolyn de Bruin. Some of the statistics on health literacy are so shocking, but very glad to see all you are doing. Thank you. Okay. So, okay, are there any other questions from the audience? Okay, we have one. What impact, if any, did or do usage statistics play in justification of the cost of access to highly evidenced resources?
Do you want me to answer that? I can answer that one if you like. It is very important. Yeah, so we do monitor usage statistics, and because we're providing many of our particularly digital electronic resources, electronic journals, databases. We have some point of care tools, BMJ, best practice provided nationally. Obviously, those costs are quite high, and we do have to monitor the usage in order to justify keeping them, really. A lot of these resources were initially purchased at national level, because it's more efficient to purchase nationally than it is for individual trusts. You tend to be able to leverage economies of scale and so on. But nevertheless, it's still important that we're able to justify costs. And in fact, a piece of work that we're doing within our team, even this week, is around looking at how we can increase the usage of some of these resources and do more promotion and marketing to improve the usage and keep the usage levels up, so that we are able to justify continued access. So good point, Cecilia. Yeah, that is something we do monitor.
Actually, if I can add on to that
Yeah,
as well,
yeah.
there is something about how that then fits in with the wider piece in terms of what it is that's the value of the impact that we have, and that actually part of the value of the impact of these resources is actually that they add to patient safety and all those sorts of elements through. And we've just starting work with a selected group of pilot sites to test out what measures might be in terms of value measures beyond the impact that we've already done, where we've actually done secondary analysis largely of other people's work. You know, how might we collect data ourselves in terms of NHS knowledge and library services to demonstrate the value? And some of that will be about, if you have easy access to evidence at the point of care, then actually fundamentally that should be improving patient safety. We would hope in terms of saving lives, but also just in terms of making sure that people have the choices that are right to them. So it's a complex area, but really important, because evidence is part of the whole work stream of the NHS. It's not just in terms of what we're providing to individuals.
Excellent. Okay, I don't see any other questions. Thank you so much for your time. We will wrap up, but I do see that there is at least one contact email in on this slide that we're currently looking at. So please do reach out if you have additional questions that you think of. Thank you, Ruth, Claire, and Dominic, for your time. And I will be in touch personally with a link to the recording that you can share out, and also some of the statistics on our on who's been watching and that sort of thing. So thank you. And with that, we will wrap up today's session. Bye-bye, everybody.
Thank you. Bye.
Thank you.
Bye.